Hello, and welcome to our next in-booth session here. This one on the real-world value of TEFCA and joining a QHIN. I am Dave Castle, Chief Customer Officer here at Health Gorilla, and with me is Dr. Stephen Lane, our Chief Medical Officer. And in addition to our positions here at Health Gorilla, we've both had the honor of being heavily involved, really from the beginnings, even prior to the passage of the 21st Century Cures Act that led to TEFCA in its development and growth over time. So looking forward to to sharing with you some of those insights and hopefully giving you some additional information on the where TEFCA is, where it's headed, and what the value is for you. Sorry, go ahead.
So
Stephen.
we're 3 months in.
We are 3 months in. We're 3 months in, and things are generally going well. But I think let's start actually with the very basic question: what is TEFCA? Maybe we can spell it, but what does that actually mean? Just for those who may not be familiar, Stephen, would you mind giving a brief of the TEFCA ecosystem?
TEFCA 101. Yes, no problem. So TEFCA, of course, the Trusted Exchange Framework and Common Agreement, is the new federally supported data exchange framework for the country. As you mentioned, Dave, you and I have been involved for decades building the existing frameworks and networks that are out there today supporting data exchange. Those were generated by the industry, by market forces, by patient needs and provider needs, and really have done a tremendous amount to open up the exchange of data to address the needs specifically around the treatment of patients, the exchange of data between providers when taking care of patients. And I'm a practicing physician. I enjoy the benefits of clinical data exchange every time I see a patient. And we did good work. We started networks. We started a framework called the Care Quality Framework that allows those networks to exchange amongst themselves. And it's really been gratifying and successful to see the impact on the exchange of data for treatment. But there are many other reasons to exchange data: for payment, for healthcare operations, individual access services, for benefits determination, for research, for public health. And all of those have been contemplated by the existing framework, but none of them could really get off the ground because there really weren't the business incentives for the private sector to make those happen. So 21st Century Cures Act gets passed at the end of the Obama administration with broad bipartisan support, and one of the things that includes is the requirement for Congress, for HHS in particular, to either build or identify a trusted exchange framework for the country. So the decision was made, rather than simply identify the existing care quality framework and say, well, that's our TEFCA, they said, no, let's start over, let's sort of reset, build on what we've learned through care quality, but give it a new name, start over again, raise the bar, really. So TEFCA raises the bar in terms of governance. It raises the bar in terms of security, and it certainly raises the bar in terms of exchange purposes and the anticipation that they will eventually be required. Now, the way TEFCA started out, completely voluntary. So, the government can only get away with so much at one time. So they have created this system. We spent a few years figuring out what it was going to look like, what its technical requirements were going to be, functional requirements, et cetera, and then getting it up and running. So it actually did go live 3 months ago. I don't know if it's to the day, but it's certainly plus or minus a week.
Actually, it might be to the day.
It might be to the day, yes.
You say that.
Yeah, and so the initial exchange purposes that are being actively supported on TEFCA are the treatment purpose, which everyone's very comfortable with, and the individual access services, IAS, or individual patient requests for data, which has been really a challenge historically to get going. But there is work afoot. The other thing, I guess, to say about the initial version of TEFCA, version 1, as you might call it, is that it relies on the technical infrastructure of established exchange. So we utilize document-based exchange using well-established technology. So really moving from where we've been to the new framework, and it's completely voluntary. Nobody has to sign up for TEFCA, but the various HHS agencies are really looking for opportunities to incentivize the use of TEFCA. So looking for opportunities within the promoting interoperability program of CMS, looking for opportunities within the information blocking program of the ONC, and then eventually more opportunities to incentivize this, with really the goal of eventually moving from the historical framework to the new framework as what will be the fiber that connects data exchange across the country, moving from the treatment purpose to include payment, healthcare operations, public health, and other purposes of use.
Yeah, absolutely. Thanks, Stephen, for the great overview of the TEFCA at its most basic level. Maybe a little bit beyond the most basic level, but the thing that strikes me about it, and looking back at my experience in being the founding executive director at Cure Equality, and all that we've done over the years, and working very closely with my colleagues at the Health Exchange and at Commonwealth, which were similar private sector-led networks. The difference that I see with TEFCA is the government engagement. I think for whatever reason, I think some of it was just a concern on the part of HHS and others in the federal government to pick a winner, as I think they perceived it, in and among the private exchange networks. I think they feared at times that there were commercial interests there that they simply didn't understand. Not that the networks themselves were commercial entities, but that there were factors that they didn't understand, and if they went with one of them, that they would potentially be having unforeseen consequences in terms of what that would do in the commercial sector. But with the TEFCA, it's readily apparent in how the agencies are talking about it and how it's being presented. The federal government is behind it, and that to me is the single greatest difference between the TEFCA and what has come before. I completely agree that there are other differences as well that are important in terms of the approach to the various exchange purposes, and the fact that it is not only limited to treatment and practice, that we've started out from the beginning with individual access services, and that we're moving fairly quickly. I think by Q3 or Q4, we'll start to see the healthcare operations purpose become one that is a little bit more widely adopted for exchange, and that also stems from the fact that the federal government is behind this initiative and is really going to be continuing to drive it. It will, I think, become simply the de facto way of exchanging data in the U.S., and I do expect that the other networks will either merge into the TEFCA, as we've already seen with, for example, Commonwealth and the eHealth Exchange becoming QHINs. I think you'll see it really become the single source of truth, so to speak, as far as national network exchange of data.
Yeah, and I think there are a lot of real advantages that come with that. One of the terms of art that, in the early days of TEFCA was the idea that it should be a single on-ramp to nationwide interoperability. And I think that Health Gorilla, we take that same approach, that you should be able to connect once and get to all of the data that you need using all the various methodologies. You made a point about, the federal government not wanting to pick a winner, which I think really is important, just given the nature of our culture. And we've seen that really working, I think, in the TEFCA framework, where all the QHINs that have been designated so far were well-established actors in the interoperability landscape, and had a constituency, had technology, had experience, and all of that was really required to be able to meet the really rigorous criteria that ONC set up, or that the RCE set up for becoming a QHIN. And now what we're seeing is additional organizations coming forward Some have come forward and said, oh, we're going to do this. And then they sort of looked under the hood and they just changed their mind and they backed away. Others have said, oh, yeah, this makes a lot of sense. There was a period of time where it's like everybody you talk to said, oh, we're thinking about becoming a QIN. I don't think that's going to happen. There are 7 QHINs today that have been identified. There are a couple more going through the process. That'll get us up to 9, which is an interesting number, with the work we're doing in California, seeing that number show up. But I do think that, it's going to be, I'll be surprised if we end up with double digits of QHINs, in the long term. I think there's going to be a period of enthusiasm and then some sorting out, maybe some consolidation. But I think, you think about it, how many cell phone networks do we really need? There were a few, then there were a lot, and now there are fewer. I think that you need a certain number of networks, really super nodes, to support nationwide exchange of data, but too many just adds unnecessary confusion.
Yeah, I would agree with that, and I think that part of the value of the TEFCA stems from there being relatively few QHINs, and there needs to be enough, to your point, for there to be choices in the market, for there not to be too much power in one organization's hands. But at the same point, too many QHINs starts to defeat the purpose as well. Relative to something like care equality, where there are probably a few hundred gateways that all need to connect to one another. Part of the promise of the QHIN is that it is the QHINs who connect to one another. And sorry, the microphone seems to be cutting out periodically. But the QHINs that connect to one another in a relatively small number of connections that we're all able to then keep up and running. One of the challenges, and from a practical standpoint, with care equality, with 300-400 nodes out there, is that there's always something going on with one or the other of them. So it's I think that's something that is interesting in the QHIN as well.
Yeah, and I think we're supposed to be talking about what is the real world value of joining a QHIN.
You mean there's something we're supposed to be doing other than just pontificating?
We can do both, but I think that there are differences. I mean, the community of QHINs, the 7 of us that are out there today, we're all quite different organizations. We use somewhat different technology. We have different areas of focus. Some of the QHINs sort of have a well-established constituency that they're really trying to serve. Others are more flexible, sort of reaching out, trying to identify, new use cases, new purposes of use to pursue. We've discussed the fact that most of the QHINs are primarily doing pass-through exchange, where they just move the data from point A to point B, whereas Health Gorilla in particular provides platform services as an addition if people want to be able to use that as part of their exchange. So I think that there are many opportunities there for people to think about what would be the best way to connect up to the new TEFCA framework. Is it through an established vendor, your EHR vendor, something that you're already doing? One of the things is that in the first version of TEFCA, which is live today, there is a requirement that any entity connect through a single QHIN. In the second version, which we anticipate coming live and going into effect later this year, there's an opportunity to use multiple QHINs to connect your infrastructure to the framework. Each QHIN should be, each data store, each system should connect through a single QHIN. But a lot of health systems, a lot of payers might manage multiple systems across their portfolio. Each of them could choose a different QHIN, and that might be just fine. If you've got an EHR that's well established, has a great connection to TEFCA, but then you've got something to do pop health management or your payment and operations on a different system, why not use a QHIN that might be able to facilitate that? And I think for the public health exchanges, we've been talking about this. There may be different needs for a CDC versus a state versus a local public health department that needs to connect up to QHIN or to TEFCA. They may have different needs from the QHIN that they choose.
Yeah, absolutely. I think you'll see each of us as QHINs have particular constituencies. Now, obviously, one of the advantages of Health Gorilla is that we are a neutral player. We're not tied to any one EHR platform. We're not tied to any particular trade association. So we are able to serve a large number of diverse customers as a QHIN. So all of that said, I think looking at why should I choose any QHIN, let alone which one, and why should I even care about TEFCA in the first place? I joked about the purpose of the session being to talk about the value of the TEFCA and why you should join, but it is actually an interesting question and one that want to make sure we talk about. In my view, a lot of it stems from the additional variety in the purposes that we had talked about earlier. I do think that with the federal backing of the TEFCA, you will see that become a real thing. We have not, for various reasons, been able in Care Equality, in eHealth Exchange, in Commonwealth, in these existing networks, to move outside of that treatment box. But I think the federal involvement in TEFCA will force that issue. So that certainly is one element of the value. Another is the fact that there is still white space out there that is not covered well by Care Equality and by the other networks. The TEFCA will, I think, do a reasonable job at starting to reach into those spaces. It's not something that's going to happen overnight. If it was going to happen overnight, they would already be part of the existing networks, probably. But as incentives kick in from federal agencies, as the TEFCA becomes more established, I do think that you'll start to see those white spaces fill in, and you will have additional data sources in the TEFCA that you do not have today. All of that said, this is a process. It is something that is going to occur over time, and that can be a little daunting. One of the things that we take pride in at Health Gorilla is abstracting away from all of that complexity, that we will serve for you in terms of your on-ramp and a single on-ramp, as Stephen referenced. Whether you don't need to care about whether data is coming from TEFCA, from Care Quality, from eHealth Exchange, from organizations that participate in all three. You simply don't have to worry about all of that. That's our job to take care of that. And a big part of the value that we provide with our platform is serving to simplify that relatively complex set of interactions.
What are the reasons, again, what is the value of joining TEFCA now as opposed to sitting back and waiting, 3 months, 6 months, a year, what have you? I think part of it is being able to be part of this as it's getting started. We've certainly seen this with the recognized coordinating entity, the RCE, which is working with the ONC to coordinate the implementation of TEFCA, has recently kicked off the first transitional governing council of the TEFCA. We have a seat at the table. Each of the QHINs does, as do their participants, and we're working through some really thorny issues. We're really trying to figure out how to build trust in the network, how to work with ONC, really coordinating this with evolving federal policy and even state policy. I mean, you're seeing some states pointing to the TEFCA as the preferred method of exchange. So I think that we're really enthusiastic when people want to get involved early and help to chart the course, because I think, as we've said, it's voluntary at first. There are incentives. There will be increasing incentives, and then eventually we're going to see things kick over into requirements. It's like, yes, you can be involved in this program at the federal or state or private level, but only if you're exchanging data using TEFCA. And I anticipate it's not going to be even 3 years until somebody requires TEFCA exchange for something.
It's not us, right? Okay. I agree. I definitely do not think it's going to be 3 years. I think it may not even be 1 year before we see there being, not necessarily an across-the-board, thou shalt participate in the TEFCA if you're in healthcare, but that there will be some program out of CMMI, for example, that part of the deal of participating is going to be that you need to be engaged in the TEFCA.
Yeah, and they'll do that strategically. I think HHS is really thinking holistically. Again, CDC is going to be leveraging this, CMS, probably NIH, as TEFCA moves into the research space. We're going to certainly see the HRSA, I think, has already gotten involved.
Yeah, and I wanted to just emphasize your point about being in the room where it happens, so to speak, in terms of the opportunity that is out there right now. The Transitional Council, as you referenced it, is up and running. There is actually a move that will be occurring to a longer-term, more permanent governance body for the TEFCA, and there are opportunities to be part of that group if you are in the TEFCA ecosystem and you're having the ability to join now and have your voice heard in those forums.
Yeah. And the Transitional Council itself is spawning other councils. There's a cybersecurity council that's about to meet for the first time. So there really are opportunities to help to design the system that we're all going to be using over time.
Indeed. So I think to wrap up, there are certainly reasons that you would want to join the TEFCA now. There certainly will be reasons down the road. I would encourage folks to go ahead and get started, to onboard into the TEFCA while you have the optionality and not when it becomes a forced rush, and be able to get in and offer, appreciate the benefits that you can see.
And I think we're happy to take any questions if people have them in the audience. Yes. Here.
Okay, so I understand that Health Gorilla is a QHIO within California, and you are also a QHIN. So how does that work out? Like, what does that mean? Is it like, are those two disjoint things? And I'm Shaljina from Elevance Health. Are those two disjoint networks, or they come together? How does that work out? And I have another question.
It's a great question. I'll start and then pass it over to Stephen. I mean, they are two completely separate things, for better or worse. And to my earlier point about the role that we play in simplifying for our customers the connections between the eHealth Exchange, Commonwealth, Care Equality, now the QHIN world, the DXF, the Data Exchange Framework in California, and the QHIO ecosystem just sort of becomes another of those things that we're able to abstract away from the complexity for our customers. But the complexity is there. It is a truly separate initiative with separate governance, and the transactions that occur under the Data Exchange Framework are not really all that different technically, but they are distinct from a governance standpoint from the transactions that occur under the other frameworks.
Yeah, also, the two systems have very different socio-political history. They came out of different motivations, and they have different participants, really. So I think the California Data Exchange Framework, we actually did a session on this just an hour or so ago, so you might want to catch the recording on our website when we get it up there. But it really is broader in its scope. It's looking at broader data, including social service data. It's looking at a broader set of participants. It's actually a legal requirement in California, as opposed to TEFCA, which, as we've said, is really a voluntary framework. So I think over time they'll be merging. You'll notice there was a big piece in Health Affairs a couple of weeks ago that focused on sort of how they align with one another. So I think increasingly they are aligning, but they're really quite different. And you're right, Health Gorilla is in a unique position, in terms of having a foot in both worlds to be able to, as Dave likes to say, abstract away the complexity of that arrangement.
We did implement the California Data Exchange Framework. We went live on 131, the compliance date, just FYI. So other question I have is, when you said Health Gorilla also provides platform services, and more than just acting as pass-through. What does that mean? Like do you translate FHIR to IHE, or like what kind of platform services you're talking about, other than the trusted framework?
Actually, that is one of the services that we can provide is that translation layer. If you have a pure pass-through as the QHIN, there's a couple of things that have to go into that. One is you have to speak the QHIN language in order to send and receive those transactions, or at the very least, you may be able to do some translation, but it's only at the transaction level as opposed to the data level. Whereas when you have the platform where the data has the opportunity to stop there, it gives us the ability to provide some additional services to our customers, including more complete translation of the transactions. So our customers interact with us via Fire APIs, and that occurs not only in the triggering of the transactions, but also in the retrieval of the data. I mentioned this in an earlier conversation where there's a tipping point that occurred somewhere, and I think none of us really marked it at the time, where it went from, wow, I wish I could get the data, to, oh my God, there's a lot of data. So we take that data, and if all you really want, for example, for a particular use case is to get the lab results, well, you can use our APIs to get the lab results and not necessarily get the 1,000+ documents that came back for any given patient. So being able to do that aggregation and deduplication and then also give you more retrieval options is a big part of the value that we provide with our platform.